Jeremy Ward, I'm the Chief Data Officer at Stratum Data Services, which is a wholly owned subsidiary of Stratum Med. It's a large managed services organization that's owned by 24 medical independent shareholder groups. We create an analytics and data platform to empower independent medical groups and give them the capabilities of a large health system. Each one of these clinics are living in a world where their data is siloed. They have to put in a data team ticket in order to really get any kind of questions answered. And so that creates an incredible amount of inefficiencies. We would hear certain things, again, anecdotally, that it would take days for somebody to respond to this question. And then oftentimes we also hear never. So when we were looking for an enterprise BI solution, Sigma was the easy choice. Most of our operators that are running these clinics are used to Excel. Through Sigma, we're able now to put that on top of our warehouse and give our operators the ability to truly have self-service analytics and answer their own questions. The operators, the COO at the clinic, the CFO at the clinic can easily go in and create a pivot table directly from the warehouse. That capability alone unlocks an incredible amount of power. You're literally going from sometimes never, sometimes 6 weeks, sometimes a year, to answering the question within 5 minutes. We are able to look at things like appointment utilization. And so what that has unlocked for us is truly having cross-clinic or cross-group collaboration. You're running at 103% of appointment utilization for primary care, and I'm running at 80%. What are you doing differently to run at 103%? And so in the past, that conversation wouldn't even have started. Now the clinics are able to have operational leaders talking to each other, or looking at the same piece of data and actually making changes. And now they've actually implemented changes, and we're seeing a 15% lift in their appointment utilization. Another area is claim denials. Being able to reduce claim denials generates real money. So for example, one of our clinics, we've looked at if they just reduce their claim denials by 3%, that could be an additional $10 million. It's highlighting areas that these clinics know anecdotally were challenges for them, but now giving them a tool that, number one, is real time and gives them the insights that they need to recognize these patterns. Healthcare, especially AI, has hit it pretty hard. There's this question of where does BI, where does business intelligence go next? And I think it's very clear that it goes into this chat-like experience to allow our users to chat with their data and answer their questions even faster, so that I, as a COO, don't even have to build a pivot table anymore. Now I can get an answer within 30 seconds, right? And I can just keep moving and work through those ad hoc requests. So we're very, very excited around that, sort of integrating AI with our Sigma instance and having that chat with your data type interface. In US healthcare today, independent groups are slowly getting eaten up by hospital systems and eaten up by private equity-backed firms. That's pretty poor for healthcare, because independent groups are sort of the backbone of US healthcare. If you took Sigma away, you took our warehouse away, it would put them on a path of continuing to lose more and more revenue as the squeeze comes down from payers, as the squeeze comes down from the federal government as it relates to Medicare and Medicaid. This capability is truly opening up the doors for them to operate more efficiently in a world where things are getting more and more challenging to operate that efficiently. Why use Sigma? Is meet your users where they're at, and most users are comfortable in spreadsheets.